Hi, I'm Steve. I'm the CEO and partner of Fitness for 10. I'm here today with a friend of mine and Dr. Nario. He's with Biointegrative Health. It's a great clinic. I recommend that you go check it out and see what kind of services they provide. So today, doctor, there's a scare out there about viruses and all kinds of stuff, but I want to kind of keep this kind of general. And the first question I have is, how can vitamins, let's just take vitamins, are vitamins, is there something that vitamins can do? Is there a certain type of vitamins that we can take that can help our immune system and keep us strong and healthy from the beginning so that maybe we don't get the common cold or the flu or whatever it might be?
Yeah, so that's a pretty good question because we always get that a lot from our patients. So vitamins are pretty essential, meaning that our bodies, we always consume vitamins every day to keep us going, to keep our systems running. So vitamins always gets depleted, especially now. We always talk about sources where we get our vitamins, and these are food groups or food sources. Right now, our food sources are not of the best quality. If you heard about the processing, you talk about GMOs, you talk about chemicals, pesticides added to our food sources, we know that whatever we had way back with our ancestors, we're not eating the same healthy food. So that's why supplementation of vitamins comes into play. And how does that help? So with vitamins, it does not only build the immune system, as you mentioned a while ago, but it also keeps the other systems running, cardiovascular, pulmonary, muscular, endocrine. So it's just the fuel of our bodies every day. And as we all know, people kind of now has this trend of jumping into supplementation. But the problem here is supplements should be taken as an individualized approach. Everybody needs something different. So that's where we come in as healthcare providers to assist our patients to understand what specific vitamins you need. And with our current recommendation right now, as general advice for our patients, because everybody just wants to build their immune system and build protection. So basic recommendations that we can give for you would be, of course, number one, you have to be on a good vitamin B complex. So when I say vitamin B complex, we talk about methylcobalamin, B12, thiamine, riboflavin, dexpanthenol, and also folic acid. All of these are in one capsule. So you just look for a good B complex out there. And B's, you can name anything that a function that a body does, B is always involved. Muscle regeneration, energy, every organ that needs to function needs vitamin B. So it's just an essential vitamin that we use every day. Next would be number two, vitamin C. Vitamin C, always the most famous vitamin that's related to your immune system. Why? Because it's a potent antioxidant. So vitamin C recommendation that we can give, at least 1,000 milligrams a day would be fine. Next would be number three. Another one is the sunshine vitamin, which is vitamin D. Vitamin D, this is also related to cardiovascular health, immune system, and recommendation for this would be at least 2,000 international units a day to be taken with meals. So those are the basic vitamins that I can give you. And of course, there are add-ons such as minerals. So minerals such as magnesium. Magnesium, always good for sleep aids. Somebody's having a problem with sleeping, you can take that. Constipation, it helps you regulate your bowel movements. And also, again, immune system booster. So magnesium can be taken 200 milligrams at least 2 times a day before going to bed. And then another one would be zinc. So zinc is a very interesting one because you would hear this a lot, especially the viral season comes into play, the flu season. So zinc, at least in the dose of a good 50 to 100 milligrams a day would be fine. And it's also best to be taken when you're actually manifesting actual symptoms of a viral illness. So those are basic touch-ups on vitamins. And definitely there's more to it than just recommending a broad amount of vitamins, because we always, in our clinic, we correlate this with your blood tests, with your current condition. That's why I always say, It's always individualized when you approach vitamins towards a patient's recommendation.
Wow, that's great, great information, doctor. And it makes me think of so many other questions that I want to ask you. So we want to do this again. We want to bring you back. I want to ask you about sleep and some of the other things that you brought up. So we're excited to have you on, and we want to have you back, maybe on a regular basis, because I have a lot of questions. So I want to thank you, and we'll see you next time.
Awesome. Thanks, Steve.